Hi everyone, and hi to all of our attendees that are on this webinar. Thank you for joining us on this Sunday evening. My name is Jess Mears. I'm the Libertarian Party's membership manager. I am at our headquarters in Alexandria, Virginia. It was a beautiful day. So thank you so much for joining us. The reason why we are having this call this evening on this topic is government-sanctioned medical torture, pain treatment, the healthcare industry, and bodily autonomy. The reason we're having this call is because a woman called our headquarters a few months ago, reaching out after she found a press release on LP National's website. The press release was Libertarians support patients who need access to pain relief. She called and she wanted to know more about what are libertarians doing to support pain patients, because she is a pain patient herself and she is tired of the political system working against her. So because of this call from a person interested in learning more about libertarian solutions to pain treatment, I reached out to Cara Schulz and Dr. Cara Varner to be panelists on this call today. As the Libertarian Party's membership manager, I want to create resources for our members. If one person is interested in a topic, then there's others out there. You can share this information far and wide. It's live streaming on our Facebook page right now, and it's going to be a resource for years to come. The Libertarian Party wants communities to know that we're advocating for them, and this conference call is a way for us to provide this kind of information. This call is going to last 1 hour. If you would like to ask a panelist a question, you can put it in the chat, or if you'd like to make it a private question, you can send it directly privately to me and I will ask the question to our panelists. So Dr. Cara Varner, he's a lifetime member of the Libertarian Party and he's a practicing hospitalist and expert in healthcare policy. In his upcoming book, White Coat Cartels, Dr. Varner uncovers a dark side of the U.S. healthcare market. Dr. Varner passionately stands for freeing the market and advocates cash-based services and medical tourism as the prevailing alternatives to a compromised healthcare system we are faced with today. He's a highly sought-after writer and speaker and has spoken at a number of conferences around the world. He shares an insider's knowledge on his website, drvarner.com, to give people the tools they need to take back control of their lives and start making informed decisions about their health. Kyle, would you like to take a minute to say hello to our audience?
Well, hi everyone. It's great to be here with you, and I'm really looking forward to sharing with you what I know about opioids and what the U.S. government's drug policy is doing in terms of public health and how many people are being killed by an irrational drug policy. And so I'm looking forward to explaining all of that to you.
We'll be back with Kyle in just a few minutes. Cara Schulz is a member of the Libertarian Party's staff. She is our candidate recruitment specialist. She's a stage 4 cancer survivor and an advocate for humane pain management for cancer patients and chronic pain patients. She has testified on behalf of pain patients at the Minnesota State Legislature, and she's the co-founder of the Minnesota Pain Initiative. Cara, would you like to take a minute and say hi to all the attendees?
Thank you so much for attending this. This is a subject that is reaching a true humanitarian crisis in the United States. And it's something that I think a lot of people aren't aware of yet, but people are going to become more aware of this as it begins affecting them and their loved ones.
Thank you, Cara. And as I mentioned just a few minutes ago, the reason why we're doing this call tonight is because somebody reached out to the Libertarian Party. If you know of an issue that libertarians could be advocating for people for, or that we can share more information, more knowledge, just as we are tonight on this issue, please get involved with the Libertarian Party. If you're not sure how to get involved, go to our website, lp.org/hangout. We do a weekly Tuesday meeting to help people get involved and learn more about the Libertarian Party. So with no further time to spare, let's go ahead and turn the call over to Dr. Varner. He's gonna have about 10 minutes of information, and then Cara will then share information after Dr. Varner, and then we're gonna have Q&A. So Dr. Varner, the floor is yours.
Well, thank you, Jess. So I'd like to begin by telling you guys about the youngest person that I ever declared dead. That was a 19-year-old man. And the way it happened is this young man went out partying, came home, went to bed, and his family found him the next morning, basically dead, called 911. And CPR was started, brought to the hospital, and I was called into the ER to help with this resuscitation effort. And we spent hours trying to resuscitate him, but ultimately it was to no avail. And we determined that the cause of death was an opioid overdose, but it wasn't just any opioid. It was carfentanil or fentanyl, one of the two, a synthetic opioid that's just kind of burst onto the scene in the last couple of years. And these are somewhere between 1,000 and 10,000 times more potent than heroin gram for gram. So just to give you an idea of what that means, is it means that 1 gram of carfentanil is just as potent as an entire kilogram of, it's 10 kilograms of heroin. So you can imagine if somebody is using a substance that is carfentanil and they don't know it's carfentanil, how easy it is for them to overdose. So this is really scary. And unfortunately, government drug policy has played a role in shifting the market, the black market, shifting it away from either, which is relatively safe, which is things like oxycodone or other prescription strength opioids, to things like heroin, and then to things like fentanyl and carfentanil that are the really deadly things. And so what we've seen is a gigantic increase in the number of people who are dying every year from these overdoses. We've had almost 80,000 deaths in the last year from opioid overdose. The majority of them are from synthetic opioids, and then a minority of them are from prescription opioids, but the majority of those are actually in a setting of polysubstance use. It means people took opioids and then other substances. So what happened? Why did this take place? Prescription opioids were used widely 10 years ago by doctors, and there were problems, but not problems like we're having today. And the answer comes, unfortunately, to the FDA, because the FDA several years ago said to the makers of oxycodone, you are required to change the formulation of your pills. You must make them less abusable. So you must make them so they can't be crushed. And so the makers of OxyContin changed the tablet formulation. And now OxyContin is a tablet that if you try to crush it, it turns into a gel that you basically can't use. It means it's less abusable. But here's the thing. That was undertaken at the same time as doctors started being pressured to write fewer opioid prescriptions. And when I say pressured, I mean that they have been selectively throwing doctors in jail for their opioid prescribing practices. And it makes all of us very afraid to write prescriptions for opioids. And we want to write a prescription for a small amount. We want to only write it for a short period of time, all of these things, because we're afraid of going to jail. They've made a show of locking several doctors up. They send us letters about opioid prescribing guidelines. They say they call us when they think we've prescribed too much, all kinds of pressure that has nothing to do with patient care, but everything to do with the government's determination that they want to restrict the supply of opioids. So they started doing these two things, putting pressure on doctors, number one, and number two, mandating that prescription opioids be less abusable, which sounds like this should make the problem better. But it made the problem dramatically worse. Because what it did was it took away all of these relatively safe drugs from the black market supply. And what happened? Did people say, oh, well, the safer drugs are no longer available. I guess I'll get clean now and not abuse drugs? No, they didn't say that. They went to heroin that's more easily available and cheaper. And then, because heroin is kind of difficult to smuggle because you have to smuggle kilograms at a time, people started to figure out that if they could get a more potent substance, they could smuggle smaller quantities, have an easier time, and then mix it with an inert substance and sell it as heroin. Black markets don't deliver high quality products. And the result has been tremendous carnage in the United States. It's been tremendous heartbreak. 70 to 80,000 people in the last year have died. And the majority of them have died because of the government policies. And so we know this because we also have a pathway by which people can obtain opioids safely when they're addicted. It's called medication-assisted treatment. There's a drug called methadone, and there's a drug called Suboxone or bupropion. And these medication-assisted treatments are extremely effective. And I've personally seen people go from being a junkie on the street, I hate to use that word, but a homeless person on the street addicted to drugs. They get into this opioid assisted treatment program. They get onto methadone. They get better. They go get a job. They get a life. They get an apartment. They go from being a dysfunctional person on the street to being a functional member of society who has a happy life. And so what we're finding is that you can go one of two ways in policy for opioids. One is you can say, we're going to restrict the supply of opioids. It's a command and control approach. It's a top-down government-directed approach. We're going to restrict the supply of opioids and demand that you be a better person. On the other hand, you can say, we're going to give you the opportunity to take the medications that you feel you need, whether it's because you have an addiction, whether it's because you have pain, we're going to give you the opportunity to do that safely. And by doing that, we're going to allow you to have a life. And on the one hand, opioid maintenance therapy or opioid medication-assisted treatment for addictions has been a tremendous success. It's helped so many people live normal lives. And so then you see this other top-down command and control approach, and it's resulted in so much carnage and so much death. And the answer is really clear to me, and that is freedom. You know, just last week, Senator Ted Cruz and Congresswoman Alexandria Ocasio-Cortez joined up to offer a bill to make birth control available over the counter. And I really applaud them for that effort, because I don't think that a woman should require my permission in order to control her own reproductive health. But I'm going to go a step farther, and I would say that pain patients shouldn't require my permission to access safe pain medication. It's not my choice what they do for their pain. I have a lot of training and a lot of knowledge, and I can help somebody a lot. And I want to be perfectly clear, I'm not a big fan of opioids. I think they have a lot of long-term side effects. I think they're dangerous. And I don't like to use them myself. I had surgery several years ago. I didn't even fill the prescription for pain medication afterwards. But that's a personal decision. And it's a personal decision that should be made by a patient with the help of their doctor. And there should not be the involvement of the government. And what we've seen is that this top-down, centrally planned approach that tries to make individuals' healthcare decisions for them has resulted in tens of thousands of deaths. Instead, we can embrace the idea that people have bodily autonomy. And that means that if they feel they need a pain medication, that's up to them, not me and not the government, not Donald Trump, not the Attorney General, not the DEA, the patient. And if we embrace that, we're going to see a reduction in overdose deaths. We're going to see a reduction in other complications of opioid abuse, like skin infections, like heart infections that we see very frequently in people who are using black market opioids. And we're going to see the world be a better place. You know, if you have an opioid problem, it's a problem for you. But if the government makes the opioids that you're addicted to cost $80 a pill, you're going to do one of two things. You're going to have to either turn to crime, or you're going to have to turn to a cheaper but less safe or a more dangerous substance like heroin or carfentanil. So this is a government-driven crisis, and the solution is liberty. It's that simple. And until we are able to change the paradigm in public thinking that says, oh, there's a problem, let's use the coercion of government to solve it, until we're able to change that paradigm to the paradigm of saying central planners can't fix problems. Government violence against peaceful people doesn't save lives, it kills people. Until we change that paradigm of thinking, the government's going to go right over, just steamrolling over pain patients. They're going to be steamrolling over people with addictions. They're going to be leaving dead bodies in their wake. And we're going to be suffering as a nation with our public health and personally with personal tragedies that are going to affect us all. It's not the right way to do things. The right way to do things is to embrace freedom. And free people, some people will make bad decisions, but free people tend to make good decisions. They tend to prosper and thrive. And I believe the American people can prosper and thrive under conditions of freedom. So I really hope that the Libertarian Party is able to have influence in this in this matter, because drug policy, and we can talk about all kinds of drug policy, but just opioid policy is really, really killing people. And we're going to hear more about, and I've already mentioned it, I am afraid to prescribe opioids, and I get accused of under-medicating people for their pain. And I do my very best to medicate people appropriately, but I have to think of two things. I have to think of what's appropriate for my patient, in what I know medical science to be, and I have to think of what's going to keep me out of jail. So just remember that your doctor has to weigh taking care of you against the risk of going to jail, and taking good care of you may not be possible because of DEA regulations and the fear that exists, because we're all practicing medicine right now when it comes to prescribing controlled substances in a climate of severe fear. So that's the first side of the coin. The other side of the coin that I want to mention to you guys is the other medications that are also restricted that have the potential to replace or augment opioids as pain management medications. And these include ketamine. Ketamine is an excellent pain medication. It's being used for chronic pain patients off-label, and the doctors who are doing it sometimes get threats from state medical boards or from the DEA. Then there's also medications like LSD and psilocybin that have some very promising properties in terms of treating chronic pain. But for the last 40 or 50 years, LSD and psilocybin have had their research basically suppressed, funding cut off, research permission denied, and all of these kind of things. And so now we're operating in a system where we know there are probably some better ways than opioids to address people's pain, at least some people's pain, but they're underdeveloped scientifically, they're not well accepted. And so what the government is doing is they're saying, hey, don't prescribe so many opioids on the one hand, but for the last 50 years, they've impeded research in figuring out non-opioid ways to manage pain. It's cruel. So from the perspective of a pain patient, it's cruel. From the perspective of a doctor, it's extremely frustrating to have to weigh my patient's needs against my needs to be free. And from the perspective of anybody who has an addiction problem or anybody who's using them recreationally, the risk of death has gone through the roof. So US drug policy has been a complete disaster, but I'm also convinced that the Libertarian Party is the one political party in the United States that has solutions that can save lives and make the world a better place with freedom.
Thank you, Kyle. Does that wrap up your portion of information?
That'll wrap up my portion, and I'm looking forward to, after Cara's portion, to answering lots of questions and having a really good discussion.
Wonderful. Thank you so much for all of that information. We have people viewing live on Facebook. If you would like to join in on the conversation, we're using a Zoom webinar right now. The registration link is available on our Facebook page, and you can still hop in and get your questions answered. Cara, let's go ahead and turn the call over to you. And we've got about 10 minutes from Cara, and then we're going to go into Q&A.
I want to get one thing out of the way right away. So one of the top questions I get asked by libertarians in any discussion of pain medication is, what about marijuana? What about cannabis? What about CBD oil for managing pain? Yes, that can absolutely help. But there are levels of pain and types of pain that absolutely, utterly cannot be touched by any marijuana derivative whatsoever. And those are the types of pain that we're talking about when we're talking about cancer patients and we're talking about chronic pain patients. This is not a temporary thing. This is not a lesser amount of pain. This is not a dull pain. This is a screaming in agony, hour after hour, day after day type of pain level that we're talking about. So marijuana absolutely has its place. CBD derivatives absolutely have their place, but do not ever for one moment think that they can take over for opioids right now. As of this moment, we do not have anything that can take the place of opioids. Believe me, if pain patients had it, or if cancer patients had it, they'd be using it. So I'll just get that out of the place right now. Another question I get is, and I saw one of the questions pop up, and they were asking about addiction, and is that patient driven? Is it doctor driven? Is it overprescribing, that type of thing? So this addiction is not it does not have anything to do with prescription drugs prescribed under the care of a doctor if they've been screened by a doctor for a prior addiction. Okay? If a patient is under the care of a doctor, they've been screened, they do not have a prior addiction, there is a less than 1% chance that they will become addicted to an opioid. And that includes chronic patients who are under the care for months to years taking an opioid. So it's not a case of addiction. And yet we have this narrative now that is everywhere. And the narrative is that the overdoses and the increasing addiction rate is due to prescription drugs, you know, patients taking drugs under the care of their doctor, and then they become addicted. And that is not the case. What happened was, several years ago, there was increasing advocacy for addicts so that they could have access to services to help them. And I fully support that. You know, people dealing with addiction should be able to get support and help, medical help. But there wasn't a lot of sympathy for that. And in fact, the response from the general public was, you know what? If a junkie overdoses, I guess they just took out the trash themselves. And that's a very cold-hearted way of looking at things. But that was the response that really well-meaning people that they were getting back, who were trying to help people with addictions. Then they stumbled upon this other narrative, and this narrative took fire, and everyone took it to their heart, and they believed in it, and they could completely see and empathize with it. And it started to drive public policy to a more compassionate embrasure of people struggling with addiction. And that narrative was, you know, you're just going along in life. You get hit by a drunk driver. It's no fault of yours. You suffer this horrible accident. You're in chronic pain. The doctor prescribes you an opioid, and you take it because the doctor knows best. And all of a sudden, like 2 pills later, you're addicted, and you're, you know, doing anything to get your next fix. That was a very powerful narrative. And does it happen? Absolutely, 1% of the time. But man, that caused public view of addiction to just shift. And so they're going to ride that narrative. And we see that narrative with our politicians who want to do something, because remember, you got to do something to get reelected. And that narrative is being used for people who are advocating for addiction help as well, because they want that sympathy to help push this forward. And so that's what we're seeing. But this is not anything to do with really prescription medication taken by pain patients or cancer patients under the care of their doctor. So our current policy is targeting doctors, it's targeting pharmaceutical companies, and it's targeting patients as well, because they're easy to get a hold of. We know who they are. They know who they are. They have a list of doctors who are prescribing and patients who are receiving. And so that's very easy to target those people and to do legislation to target them, for the DEA to target them, for all of our government agencies to target them. And so that's why we're seeing this huge public policy shift. And as that shifts and there's pressure brought to bear, there's pressure brought to bear on doctors. Now they're scared to prescribe. There's pressure brought to bear on pharmacists, who are now challenging prescriptions. So even if you get a doctor to prescribe for you, you take it into your pharmacist, and the pharmacist will tell you, oh, you know, we don't have that today. You'll have to come back another day. That's what they're told to say to challenge a prescription, and they're trying to not give you the drug. And the pharmacist can now do it for any reason, and then they're shielded to do so. In fact, if they don't do so, they could be held liable either criminally or in civil court later. So, you know, that's pretty powerful. So all of this is happening, and the results are already horrific. We saw this take real, you know, gain steam in 2016. Now we have 34 states that have legislation on their state books that limit what doctors can prescribe to whom, how much, for what reason. Really, really invasive between the doctor-patient relationship. So what are the harms that we're seeing? The FDA has put out flash alerts. The CDC now is starting to hit the panic button. The American Medical Association also has come out with stronger and stronger statements against these types of public policies. The reason being, people are dying. Suicides have skyrocketed. People going on disability because they've been cut off their pain medication is skyrocketing. People who were able to go out and, you know, care for their family and hold a job and all that kind of stuff now are bedridden because of the level of pain and agony that they're in. The instances that I see, because now that I'm being more outspoken on this, I have people contacting me all over Minnesota and across the country. And they're letting me know what's happening to them in their life. And I can tell you, just in my state, since I've been advocating, we had a man who was prosecuted because he assisted his wife in ending her life. She had severe chronic pain. She was taken off her pain medication, not because she should have, but because her doctor was frightened. And so she was taken off of it. Her life was such agony that all she had left was suicide. And so her husband killed her. Her mother wrote a letter and pleaded with the court not to throw her son-in-law in jail. How would you like to have to do that in your life? The man that helped you kill your child, and you're thanking him for his compassion to your child. That's what's happening in our country right now. I know a pain patient, or a cancer patient, he also has colon cancer, as I do. He's in his 70s. He was taken off of his pain medication. He's in palliative care. He's stage 4. He's terminal. He went out and bought heroin because he can't have access to any other type of pain medication. He's never even smoked a cigarette in his life. And he's living with the shame of going out and buying heroin. And he doesn't know what he's going to get. Just like we had a young mother in Mankato, chronic pain patient, removed for her pain medication, not because her doctor thought that this should happen, but because he was scared. She went out and bought heroin because she's the only income for her family. She has to go out and work. She has to be able to function. It was laced with fentanyl, and she overdosed and died. This is the humanitarian crisis that is happening across our country. This is why the CDC is in a panic now, even though they kicked off much of this. This is why the FDA is in a panic now and putting out flash alerts to doctors saying, please don't do this, and asking state legislatures, please don't do this. Don't kick pain patients off. Don't remove these medications from cancer patients. And we also know statistically this is happening. From 2016 to 2018, the number of prescriptions given to cancer patients in palliative care, this means they're in a high degree of pain to where they cannot function, has been cut in half just in those 2 years. So anyone that says that this is not happening to cancer patients and this is not happening to people with chronic pain or people in the VA, you know, or veterans, it's a lie. This is happening. And it is absolutely horrific. And why is this happening? It's not just politicians wanting to do something so that they feel good and they get reelected. It's also because people are making money off of it. For example, one of the leading experts, and he is called an expert in the opioid crisis, is a doctor by the name of Clodney. But he is a psychiatrist. He is not a medical doctor in like an internist way. He's not a surgeon, nothing like that. But he's considered an expert in this. His whole push is to eliminate opioids. That's his push. He takes it from the view of it's an addictive substance, we just shouldn't be using it. If we had something else to replace it, I would be all for that, but we don't. So that's what we have. He is the expert witness in the Oklahoma trial that's going on right now against a pharma company. They're not calling any doctors saying that they were coerced. They're not calling any patients or families of patients who are saying because of overprescribing this person died. They're relying on the expert testimony. He is being paid over $500,000 and is basically one of the defense team. That's the charge against him, is that he's basically one of the prosecutorial team for the state. Now, if he is called as an expert in the other trials, for example, just following the money, and he can expect to earn that same amount of money, $500,000 or higher, how much does he stand personally to profit off of the sheer misery from pain patients and cancer patients? There are 2,000 lawsuits filed right now. That's a lot of money and that's a lot of motive. I am not saying that is his motive. I'm saying there's a lot of money in this for people to push an agenda a certain way. And that's something that we need to be wary of. We need to be wary of it with our government. We need to be wary of it with certain organizations as well. But the thing I want to impress upon people is this is not a prescription drug crisis. This is a crisis of fentanyl and heroin. Massachusetts General Hospital just completed a study. It was just published in the Journal of American Medical Association. In the next 10 years, we will see a 147% increase in the number of deaths, opioid deaths, and that will be due to illegal fentanyl and also to heroin. It will not be due to prescription drugs. They also noted that the policies limiting pain patients and cancer patients from having their pain treated will not make this better. It's making it worse. Prescriptions have dropped in the last 5 years, 30% overall, and yet the deaths keep skyrocketing. And I think Dr. Varner did a good job of explaining why those overdoses are climbing. But when I have hospice nurses contacting me and saying, we don't even have enough drugs for end of life to ease someone out of their suffering because of the artificial limits on the numbers of opioids that can be manufactured, that should be a concern for everyone. When I have cancer patients contacting me and saying they want to still fight their cancer, but they have to enter hospice care because they have to decide whether they want their agonizing pain treated or they want to fight cancer. So they're entering hospice care, which means they have to give up treatment in order to get their pain managed. That's the trade-off. Because we have, cancer patients are looking at this and saying, maybe I could take it, maybe, or maybe I could commit suicide, because they are. But of paramount concern to them is the thought of their loved ones watching them as they're screaming in agony and crying, and having their loved ones next to them being absolutely powerless to help them while they cry and beg for help in easing their pain. Their spouse, their parents, having your child watch that is more than most people can take. So what's happening is people have 3 options now that are left to them. They can get illegal drugs, they can kill themselves, or they can enter hospice and stop fighting their disease and just give up, which is just another slower form of suicide. And that's what we're seeing, and that's the humanitarian crisis that we're facing.
Thank you, Cara, for sharing. I have a follow-up question myself personally for each of you, and then we'll get into the questions that have been submitted by the audience. Cara, the question I have for you is, you've testified or lobbied with the Minnesota State Legislature as a cancer survivor, as a political activist, and you're also an elected official in Minnesota serving on Burnsville City Council. Can you tell us about what it's been like lobbying your state legislature?
Sure. Well, not a lobbyist, just so that, we have that legal term out there. not a lobbyist, so that no one thinks that I've crossed that line. I got involved because I am part of different cancer support groups. And we were initially told, of course, when all of this policy discussion was happening, that it would not affect cancer patients. And we saw immediately that that was a lie. And so I started to become involved advocating on behalf of my fellow cancer patients. I'm in a good position that I don't take any pain medication, because when cancer patients and when pain patients speak out publicly, they are threatened with having their pain medications removed, because that's considered drug-seeking behavior. And so that keeps them quiet. So I can advocate on their behalf, and I have been. And it's not well received by many legislatures. It's not always the best received by some of our elected officials. They would like to do what they would like to do without being hampered or, you know, having pesky people speak up. But I have been deluged, overwhelmed by the number of people contacting me, and I'm a city councilor. This is not normally something a city councilor does. But they're contacting me because they're saying, you are the only elected official speaking out about this. You are the only person speaking for us, helping us in any way. We can't get anyone to return our calls. We can't get return from email. We're blocked from speaking. We're blocked from participating in any of the legislative panels or work groups or anything like that. So, you know, it's been very, very eye-opening, just how fast this is going and how they don't want anything to stop it. I'll also tell you that many people have contacted me saying, not just me, but also saying the Libertarian Party is the only party standing with us. And I think it is incumbent on us libertarians to recognize that this policy jump is something the Republicans and the Democrats are jumping on with both feet. They're both so strong in this. And we do need to take a stand, and we need to take a very public stand.
And thank you for doing that on behalf of so many people, Cara. Dr. Varner, part of this topic tonight is bodily autonomy. I know you are a doctor in Oregon, which was an early state to legalize death with dignity. Could you share some information on death with dignity with us?
Sure. So my primary state of practice is actually Washington. We have death with dignity as well. And here's what it means. It means that if you have a terminal illness where you have 6 months or less to live, and 2 doctors will certify that and certify that you understand it, you can receive a lethal prescription. And you don't have to use it. You can set it on the shelf, but it's there and it's available for you. And if you should decide that your quality of life has deteriorated so much that you don't want to live anymore, you can take that lethal prescription. It's an issue that has a huge amount of controversy attached to it, because there are people who are religious who say this is suicide and it's a sin. There are people who just believe it's medically unethical for a doctor to write a lethal prescription. Here's the interesting thing though. Your death certificate doesn't say death by suicide. Your death certificate says the underlying cause. So if you had cancer, and this is why you only had 6 months to live, the cancer will be what's on your death certificate. And I think that's really important. But for me, I don't like to argue with people about the morality of a physician aid in dying, and we like to say physician aid in dying rather than suicide. But I don't like to argue with people about the morality, because it's an irrelevant question. Because what I consider moral should only inform my actions. What you consider moral should inform your actions. But under no circumstances should I take my morality and then attempt to pass a law so that you have to abide by it. And so in states where physician aid in dying is illegal, what you really have are religious people combined with people who just have a certain strong sense of what they think medical ethics should be, you have these people saying that they're going to impose their sense of morality on others. Now, I'm all about leaving decisions up to individuals. And if you are having terrible suffering as a result of a terminal disease, and as a hospitalist, believe me, I've seen it all. And I've seen things I wouldn't wish on my worst enemy. And I've seen suffering that can't be even dealt with by opioids adequately. I've seen all of these things. If you're in that position, you should have the right to end your life with dignity if you want to. If you don't want to, nobody's going to make you. This is an issue about individual autonomy. Your life is your own, and the manner in which you decide to end your life is also your own, or at least it should be. And I think Washington and Oregon, as well as we've got Hawaii and Montana that have some provisions like this as well, and some other states are considering it, are making the right steps in this direction, because the law creates certain safeguards to make sure that the person understands what they're doing, to make sure that it's not unreasonable, and so forth. And I think that's reasonable, because you could theoretically have people committing murder and using these kind of laws as a smoke screen to shield themselves from liability. But in this case, the law is very well designed to make sure that things are reasonable and make sure that the patient is the one who's choosing, because the patient has to ask verbally and the patient has to ask in writing. There's a series of steps that they have to go through. It's a pretty involved process to make sure that people are really doing it of their own free will. But I'm a huge advocate of that. And this goes back to the general theme. You should decide what happens to your body. Not me, not the government, you. Because you're the one who feels pain. You're the one who's going to live or die. You're the one who bears all the responsibility, all the consequences. So you should have the right to decide. And when we start letting other people make our decisions for us, those decisions don't reflect our values and they're not as good decisions, and we end up suffering. So it's all about individual autonomy.
Thank you, Dr. Varner. So let's go ahead and move on to questions that have been submitted by the attendees. If you're watching us live on Facebook, we are projecting from Zoom, and we've received questions from the attendees here on Zoom, and I'm trying to grab as many from the Facebook chat as I can. So this is a question for Dr. Varner. This came from one of our attendees. The viewer says, one of the alternatives to opioids is a combination of ibuprofen and acetaminophen. I've read, especially for dental pain, that the mix works better than opioids. While it's relatively easy enough to take 2 separate pills, have you heard of efforts to get a combined formulation, single pill, 2 medications on the market? Why do you suppose this is? Have you recommended this to your patients who express hesitation to opioids?
So yes, I have. I've used that combination a lot in an effort to avoid using opioids, and it's been quite effective. It's a good combination. Now, in terms of, am I aware of efforts for it to be developed as a combination pill? The answer is no. And I think that actually as a combination pill, it would have to go through the entire clinical trial process with the FDA. My estimation would be over $100 million would be the cost to bring a combination pill like that to market. Given the ease of purchasing the pills separately, I don't think that you'd find much of a market for the combination pill at an increased price. So in short, I don't think that there would be a way to recoup the regulatory costs necessary to bring that to market. And that's a really unfortunate side effect of an overregulated pharmaceutical development system. But does that combination work well? Yes, it works really well for some people, and I've used it to good effect.
Thank you. Here's a question from someone that's watching on Facebook. This individual says they stopped taking OxyContin that treated pain for 12 years because they couldn't get the prescription filled any longer. They now use 12 tablespoons of kratom a day with no side effects and better pain relief along with cannabis. Will the Libertarian Party support kratom, a natural product from Southeast Asia that they've used for pain for hundreds of years? Now, this is not a statement on behalf of the Libertarian Party that's coming from Dr. Varner or from Cara. These are going to be personal, their personal opinions that they'll express. So whichever one of you would like to go first.
Well, I've been a member of the Libertarian Party since 1999, so I think I know the heart and soul of this party pretty well. And I can assure you that the Libertarian Party will always fight for your rights, and that includes your right to use kratom. Kratom is a really exciting substance that has had benefits for other people like it's had for you. You're not the only person who's benefited from it in this way. And this goes to show that there's a lot of options for treatment of chronic pain and of other conditions out there that are kind of outside the FDA-regulated system. But the Libertarian Party believes in all of your rights all of the time, and that includes your right to self-medicate. So I feel very comfortable saying that you can always count on the Libertarian Party to defend your rights, and definitely the right to take kratom is one of your rights.
Cara, do you have any comments on kratom?
You know, the gold standard of medical care is that it's individualized. Different people react differently to different drugs under different circumstances. It is extremely individualized. And so, yeah, people should be able to, you know, either on their own or, you know, hopefully, of course, working with their doctor, that would be the best, right? Finding ways to manage their pain in the best way possible. There's almost never just one silver bullet for pain. It's often a lot of things. It's massage, it's yoga, it's acupuncture, you know, it's different substances that you can take, it's diet, it's many things to manage pain. Pain is very complicated and very, it's not well understood at this point. We're at the infancy in understanding pain management.
Thank you, both of you. Here's a question from one of our viewers here on our Zoom webinar. This comes from Gary. Do you believe the abuses are more patient-centered or doctor-centered? Meaning, are doctors overprescribing, or do you believe the abuses come from patients doctor shopping, assuming they can't OD on the single prescription they're given?
So the vast majority of overdoses do not involve prescription medications, even if somebody is so-called abusing the prescription medications. The vast majority of overdoses happen from synthetic opioids that are obtained on the black market. So I think that when people try to say doctors are overprescribing or people are doctor shopping, if you want to look at what that does to the death rate, to be honest, it drives it down. If a doctor prescribes too many opioids and they end up on the street, that's going to drive down the death rate because it's going to provide a supply of relatively safer opioid in comparison to what people would be getting on the black market if they hadn't been doing that, which is carfentanil or fentanyl or heroin. So the reality is that I don't think we should be bashing doctors for overprescribing when the net result of overprescribing and the net result of doctor shopping has saved lives. So that's really controversial to say, and I should probably back it up by saying, hey, I prescribe almost no opioids because I'm afraid of being prosecuted. But the reality is that you are not going to save lives by restricting the supply because you just push people to the dirty heroin needles.
So that gets into a discussion of addiction itself. We know that 90% of all people who suffer from an addiction start their addiction either in their teens or early adulthood. We know that 2/3 of them, the root cause of that is untreated trauma suffered. So if we want to treat addiction before it even starts, we need to encourage people and encourage people to help their children seek help for dealing with trauma when they're young. Most people suffering from an addiction are self-medicating because, you know, they're trying to deal with this trauma that happened in their lives. So the problem isn't prescribing or overprescribing or anything like that. The problem is we have people in emotional pain that are trying to alleviate that pain. But the predominant drug that they're addicted to initially is alcohol. And then some of them will move on from alcohol, some of them won't. Now, family members looking on may say, this person didn't have a problem until all of a sudden I saw that they were, you know, either using heroin or they were using oxy or they were using meth. That may be when they noticed or when they really couldn't ignore it anymore. But that was probably not when the addiction started, and that was not the drug it started with.
Thank you. Here's a question from Cheryl. Cheryl says, why can't we get mainstream media attention and coverage about these issues? The only one that has tried is Fox.
Yeah.
Cheryl has contacted CNN multiple times with no response. She says all of the Democratic candidates are talking about opioids, and we need to educate them as to what the real problem is. She says the number of people suffering, including veterans, is now in the millions. And she says we have to find a way to educate them because Trump, the DEA, and the DOJ will never backtrack on their policy. What are your thoughts?
Yeah, getting media attention is extremely difficult for patients right now, giving their side of things. And what we need, though, is we do need more people who are personally affected by this to go to their local media and tell them, this is the story I would like to tell. This is my life right now, how I'm being impacted, and it's being impacted by these government policies. And that's the local tie-in. The more people who come forward with this, both in the media and face-to-face in social media, the more that we can start to erase this false narrative. But this false narrative has many years to have taken root, and it is far along, and it's going to take a while to reverse it. And I can tell you that on much of the legislation that is passed, and also with these lawsuits as well, this is about money. In almost every single case, this is about governments looking for money, and that's what they're doing.
I would add that there's an incentive, the incentives under which the media operates are to get clicks, to get views, to get attention. And it's something where they want to present a very simple narrative, and they want it to have a boogeyman. And so the narrative that the doctor prescribes too many opioids and it's killing people is simple, and it has a good boogeyman. The narrative that the government is pushing people towards more harmful versus less harmful alternatives, while being true, is also more complex. And well, it has a boogeyman, it's the government, but that's not a boogeyman that the entire country is going to get behind being upset about. So it's more complex. So it's hard to get the media to follow. What we need to do is work on crafting the message and work on getting things out. And I think that having pain patients speaking up is an extremely important part of this. And then it's going to be a relentless effort to draw attention to this issue at every opportunity so that we can speak the truth. And ultimately, you know, if we can have 2 or 3 minutes of a person's time, we can explain pretty quickly what the real problem is. And I'm optimistic that we're going to be able to push back against this. But the media is something that doesn't always present an accurate story, because they're more interested in getting clicks and views and attention than they are in actually spreading the truth and useful information.
Thank you. We're running on about 7 minutes left. We may go a couple minutes over to try to get in as many questions as we can. So let's go ahead and bring down the response time to these questions to get as many as we can before the end of the hour. Here's a question from Gary. Can we reach out to the AMA and see if they will align with us? Maybe they could become a good ally if doctors overwhelmingly feel they're being targeted by politicians, not based on any credible studies, but on hyperbole and dishonest politicians. Groups like the AMA are pretty large and could be a scenario where they'd side with us over the two parties who seem aligned on this topic.
Unfortunately, the AMA is in bed with the predominant narrative that opioid prescribing is the problem. Additionally, the AMA is basically a cartel organization that exists to augment my profession's income at your expense. They are under no circumstances our friends, they are our enemies, in fact. So I don't think that there's any chance of bringing them to our side. I think we're going to have to fight them head on if we want to win back our freedoms.
Do you have any comments, Cara?
The AMA is becoming concerned, but that's mainly because they're seeing some of their most prominent members now being targeted and put under investigation. Those same members, while they're being investigated, are also being subject to civil asset forfeiture, and they're losing their homes, everything. So that is raising the profile. Do I think that they will side with the Libertarian Party? No, I don't.
Thank you. Next question. I have a friend who wanted to help stop his opioid abuse for years. However, he kept delaying that because he was afraid of legal issues and arrest as an abuser, so he avoided seeking out help for fear of this retaliation. Would you like to comment on this?
What did he avoid seeking help for? I'm sorry, I didn't catch the first part of the question.
Seeking out help for fear of retaliation.
Yeah, but for what was the beginning of the question?
Opioid abuse for many years and delayed it because he was afraid of the legal issues or arrest as an abuser of opioids.
Okay, I understand now. Well, luckily there's good news, and that is that opioid assisted treatment or opioid maintenance therapy is really well accepted, and the patients aren't being subjected to any kind of scrutiny like that. So you can go to an opioid clinic, like a methadone clinic or a buprenorphine clinic, and you can get enrolled without getting into any trouble. Even if you're somebody like a healthcare provider or something like that, where you're in a sensitive profession, you can still enroll in these, and there's a very strong protection of doctor-patient, the privacy. The doctor-patient relationship is privileged, legally privileged. I cannot, except under very rare circumstances, would I ever be able to testify against a patient. And so that information is protected from search warrants. That information is protected from everything. So if anybody out here on that call wants to get help, you can, and you don't have to worry about getting in trouble. But I realize that with all the fear mongering out there in the media, that some people are afraid to get in trouble. But they need to know that they can seek help and that there is some effective help available.
That's really good information. Thank you for sharing. Cara, would you like to comment?
Nope, fire another question.
Okay. Here is a question from a pain patient. Our question comes from somebody saying they have level 4 osteoarthritis and has had 3 surgeries in the left shoulder, dealing with carpal tunnel in both hands and thoracic outlet syndrome in the right shoulder. This person has never been offered any opioid pain relievers and has dealt with this pain for over 10 years. Physical therapy works for a while, but the pain always comes back. Is the lack of willingness to prescribe some sort of pain reliever due to the restrictive laws? This is a daily pain. There's multiple MRIs and x-rays involved. What are your thoughts?
I know that for quite a while now, doctors have been more and more loath to do a prescription, especially for someone who's going to be in a chronic pain position. And so they do want to try to exhaust every other possibility first. I can understand the frustration in trying to do physical therapy. Insurance only covers it for so long, and then they take you off of it, and then it has to get bad again, and you go back. And it's just a constant cycle. I think on these types of situations, I mean, if you're unhappy with the care that you're getting from your doctor, just like any service, and I'm not telling you to doctor shop, I'm telling you, if you feel that your concerns are not being addressed, you can always get a second opinion. You can always check with another doctor. That's the options that you have. But man, that's a tough one.
So I'll just jump in with what the medical literature says about a situation like this. And that is that for chronic non-cancer pain, for long-term opioid use, people are in just as much pain on opioids as they are off opioids after a long period of time. That's why there's a reluctance to start you on opioids. They're not really likely to provide you with long-term relief. And so where you're likely to get benefits from opioids in a situation like you described is during acute flares. So if you have an acute flare in your pain, that's where opioids might give you some benefit. But actually a long-term chronic is not going to give you benefit out maybe beyond 6 months to a year. But you'll see increasing doses of opioids. You'll see side effects of opioids that can be like osteoporosis, can be constipation, and can be all kinds of other issues that are side effects of chronic opioids. Because what you're describing are these really painful conditions that don't have an endpoint. So cancer has an endpoint usually in death or in cure. But something like this, where you have degenerative arthritis that goes on and on, doesn't have that kind of an endpoint. Something that I think we need to get into doing more is using ketamine for pain management. There are clinics out there doing ketamine infusions. Now there are people compounding ketamine into a nasal spray that can be used for acute pain in some instances, and it can bring your overall levels of pain way down. And as I mentioned earlier, psilocybin and LSD are under active research. There are people using them underground right now. There are some other things. I feel for you and people who are in situations like you're in. I unfortunately, and this is based on my training, that I don't think that opioids, chronic opioids, would be of benefit to somebody like you. But you know, if you feel like things are so bad that you want to try something like that, you know, it should ultimately be your choice. Because even if I don't think it's right for you, my judgment shouldn't be binding on you. And you know, you shouldn't think of just going to one guy or another guy. You can get multiple opinions, see what other people say. Mm-hmm. Unfortunately, everybody's very afraid in this instance. And I doubt very much that in today's environment, somebody like you described would be able to get started on a chronic opioid regimen.
We have 2 more questions. Let's get these in before we wrap up. This is a question for Dr. Varner. Do you get paid as an incentive for prescribing certain medications, or do doctors in general get paid incentives for prescribing opioids?
No, I get no incentives for prescribing anything, and doctors don't. That would be a violation of medical ethics. It would result in the loss of licensure, loss of privileges, loss of certifications, and shunning by the medical community. There are some what I consider as improper relationships between doctors and pharmaceutical companies. Those usually come in the form of consulting gigs. They'll ask a doctor to give a speech, pay them several $1,000s for the speech. They'll take you to dinner that's an educational dinner. There's actually, there was a law passed called the Sunshine Act, and you can just Google Sunshine Act database. You can look up your doctor and see if they've gotten any money from pharmaceutical companies. But under no circumstances would I or could I accept a quid pro quo payment like that. It would be illegal, it would be unethical and immoral.
Thank you. Here's the final question, and then we'll have final comments from each of you. This is a question for Dr. Varner. It comes from Ken. Ken says that a few years ago, research into a combination pill of cannabinoid and low-dose opioid to try to boost the pain-relieving effects while minimizing the risk of addiction was made illegal in Kentucky due to legislative bans on synthetic cannabinoids. Other than what's been stated here already, are you aware of any other interesting combinations, other pain mitigation medicines which are being hampered by federal or state laws?
Well, I've mentioned already here about ketamine. I've mentioned LSD. I've mentioned psilocybin. Kratom has been mentioned. These are the main ones. There may be some others that I don't know about, but I think we've hit all the main ones.
All right. Thank you both so much for your time this evening. We have shared this information on Facebook. It's live. It's streaming to thousands of people, and this is going to be information that's going to be stored and shared for years to come. The Libertarian Party generally cares about every individual, and this is why we're sharing this information here. It's targeted to people that are pain patients or in the medical industry, but this is also information that can live on and be shared in future reference for many, many years to come. So if you know of topics that the Libertarian Party could bring light to, where perhaps it's not being talked about in mainstream media and it's not getting a lot of national news traction, we can bring light to these libertarian issues so that people can be educated and get information on it. And so I really appreciate everyone taking their time to learn more about this topic this evening with us, especially thanks to one of our lifetime members, Dr. Kyle Varner, as well as one of our staff members, my coworker, Cara Schulz, our candidate recruitment specialist, on top of her day job, recruiting candidates for the Libertarian Party, giving them advice, as well as being a city councilor and championing individual liberties in Burnsville City Council in Minnesota. She is also advocating on behalf of pain patients in Minnesota and now is becoming nationally recognized for her knowledge. So thanks to both of you for sharing your expertise with us this evening. Do you have a few final words before we end this live stream?
Cara, do you want to go?
Sure. I think it's very important that people become educated in what is actually happening as far as what's happening with addiction, what's happening with opioids, what the true addiction rates are, is there doctor shopping, those types of things, and pushing back against those types of false narratives, lies, and misleading information every single time you see it. If you see it in an article, correct their facts, because they all pass around these same made-up statistics, or they're extremely misleading statistics. Push back against it. If there's a conversation going on and someone is saying, you know, this is a worst prescription thing, these doctors are pushing it, you know, these poor people are getting addicted, push back against that. It is 1% of pain patients and cancer patients under the care of their doctor who become addicted to opioids. 1%. And meanwhile, what we're doing isn't helping people who are facing addiction at all. It's killing them too. So you've got to speak up. You've got to speak up for the people who can't speak up for themselves, because, you know, they're fighting cancer, they're fighting for their lives. They're just trying to get out of bed in the morning.
And Dr. Varner, final comments from you?
Sure. Well, I would say our medical system in the United States today can be described as authoritarian. You know, you need to go to a doctor for a permission slip to buy birth control, to buy your blood pressure medication, and you need to go to a doctor for a prescription for your pain medication. But ultimately, you shouldn't have to, because it's your body, your choice. And so when it gets down to it, the moral of the story is that you need to be in charge of your own health, and that individual liberty should prevail at the end of the day. So that's the libertarian solution, is individual liberty and respect for individual autonomy. Thank you.
We'll go ahead and end this live stream now. Thanks to both of you and everyone for watching.